we're concerned when any person dies by suicide. We are certainly alarmed by the numbers. However, we are concerned about each and every one of these people that felt that they didn't want to live anymore. And it's a priority for us at the mental health unit at the Ministry of Health because research tells us that suicide is one of the most preventable forms of death. People many times would leave clues. There would be signs. It's not something that just happened, as people like to say. There are always clues, and so we know that there are strategies that are effective in preventing suicide. So what we have here today at this workshop is a group of 60 plus stakeholders, which are people who have various interests in suicide prevention. And we have gathered them together to see if we can come up with a coordinated and integrated strategy to fight suicide.
And that fight, however worthy, is made more daunting by the prospect of the statistics compiled by the Ministry of Health. Of reported suicides over the last 4 years, an average of 2 per month, 4 in every 5 were completed by males. But females are twice as likely to attempt suicide. It is also noted that attempts are more common among teenagers and young adults. Worryingly, however, successful suicides are mostly carried out by mature adults. Part of solving the problem, says the ministry's surveillance officer, Nurse Lorna Perez, is understanding and analyzing this data.
That is what the data is telling us, and now we need to find out the why. Why is this happening? And the reason for looking at the data is to see who is affected, how are they affected, and with what. So when you look at the methods that they use, the age groups that are affected, the sex of the person, these are the things that can guide the persons who are making the decisions in addressing this issue, can use as a guide. When you look at the persons attempting, these are the younger population, mostly those 15 to 19 years of age. Those of completing suicide now are those 20 to 39. However, as I mentioned, we cannot ignore those 10 to 14-year-olds and those 65 years and above, because these are the two extreme ages that probably we might tend to ignore, and we really need to look at everybody that is being affected.
Former Belize Mental Health Director Dr. Claudina Caetano, who is now Regional Advisor for Mental Health with the Pan American Health Organization, outlined the expected outcomes of the 2-day consultation.
No one should die by suicide. Okay, we're saying that suicide is a public health issue. It's a serious public health issue, and as a serious public health issue, which is preventable. So, what are the actions that we can do to prevent suicide? One is way too many. So we want to be able to have people, give people opportunity to find solutions for the problems rather than resort to suicide. So actions in terms of promotions, prevention, reducing stigma, increasing public awareness, having people having more access to people who have to healthcare providers that are trained to be able to support them, to be able to do a diagnosis, do an assessment. So there's, and then, talking about the means, when you talk about access to means, like access to poisoning, what are the regulations and how we could change, how we could look at the gaps in terms of regulations for pesticide, control board, and then the storage of the pesticide, looking at all the little gaps that are there that will make it more easily accessible for people to drink poison rather than going to seek help.
Aaron Humes reporting for News 5.